A lady had to encounter three members of the family dying within a week. The death of someone you love. A lady had to encounter three members can occur. The bereavement is the process of grieving and letting go of a loved one who has died. To discuss coping with life and bereavement in this situation called the thanatology, we have a distinguished handpicked faculty and would now like to request our academic dean, Professor Dr. Anukan Mittal, a renowned psychiatrist of international repute, to let us know more about the faculty and to introduce the topic. Over to Dr. Anukan Mittal.
Thank you very much, Dr. Tao. A very nice introduction by our trustee, managing trustee. Yes, the reason why we felt the need to have this topic at this particular moment in time was very clearly the fact that Karen, am I audible? First thing, I'm sorry.
Yes.
Yeah, okay. The reason we felt was that never in the history of mankind since the Spanish flu in 1914, almost a century plus years ago, have we had such a severe pandemic, a severe mortality-inducing illness spreading through such a short period of time, creating such a lot of devastation and desolation in its wake as this COVID-19 done. We have seen multiple deaths in families, in cultures, within close societies. We have seen as doctors and the frontline warriors. Just yesterday, I've lost a student who had just joined gynecology. Another student who just started post-graduation in microbiology, who was testing about 200 COVID patients, potential COVID patients a day, herself succumbed to it. We are losing colleagues every day, even in the city of Bombay. I have had two people from the same family die in one building 2 days ago. So it is a devastating catastrophe which is laying low everything in its path. And as Dr. Tao said, that it does not look at culture, does not look at your religion. Death does not follow any rules. It has been affecting people's walks of life. And to compound the death has been the devastation, the ripping apart of the social fabric which holds our culture, our society together. And rendering this fabric asunder has left people very desolate, very lonely, and very frightened. Because as Dr. Tao said, there are rituals which have evolved over centuries to help us cope with the grief, to prepare us for the bereavement of loved ones, of relationships, of professions, and of the way of life that we are used to. We are losing all of this. And to cope with all this, every culture, every religion has certain set rituals, set customs, which help not remove, but at least attenuate and lessen the pain or the feelings associated with the bereavement, and helps us grieve better so that we recover over time quicker and carry on the lives. That is something which is in the realm of people who are specifically trained and knowledgeable. And we are indeed very, very fortunate to have a very distinguished, I wouldn't call them faculty, a distinguished panel Because they are not only teachers, they are people who are working in this field of grieving, and bereavement. They are people who help people in their process of learning to grieve better. Uh, to begin with, we have Miss Naina Sabharwal. She is the co-founder of an NGO called We Hear You, India's only support group for families who have lost loved one to suicide. She has a master's in psychology and the neurosciences of mental health from King's College London. She is also trained in mental health and she is a suicide interventionist. We have heard of interventional specialist, cardiologist, interventional radiologist. She is a suicide interventionist. She has spent past few years researching suicide and bereavement. She also has a master's in social policy from the London School of Economics and has spent the last 13 years running the non-profit, the NGO in the non-profit education center, bringing quality education to public sector schools in Mumbai and Pune. She has personally lost loved ones to suicide and is quite keen to make India suicide-free. The next speaker is the next person to share her experiences with us is Dr. Seema Rao, who is a consultant from the Department of Palliative Medicine and Supportive Care, Kasturba Medical College and Hospital in Bangalore, in Manipal, sorry. She is also a palliative care consultant for the Lean Collaborative for Palliative Care Asia Pacific network based in Singapore. And she's an honorary tutor, School of Medicine from the UK College of Cardiff. She completed her postgraduate studies in psychiatry in the year 2001 from Rajiv Gandhi University of Health Sciences in Bangalore. Her work in the field of mental health involved working with vulnerable and abandoned, the destitute, the elderly, those with dementia, chronic mental illnesses in Mumbai. She completed the National Fellowship in Palliative Medicine and joined Tata Memorial Hospital in Mumbai as a Senior Research Fellow in Geriatric Palliative Care. During her tenure for 6 years, she was responsible for clinical and administrative functioning of the, how many beds was that? 13-bedded inpatient palliative care unit in Tata Memorial Hospital. She has done her master's in palliative medicine and with distinction from Cardiff in Wales in United Kingdom. She is now, we are very sad that Bombay lost her to Manipal. She is now working as a senior consultant in the Department of Palliative Medicine at Kasturba Medical College Hospital in Manipal, which is a flagship of the Manipal Academy of Higher Education. But she continues to be an honorary tutor at Cardiff University. She's a full-time faculty with the cancer treatment centers in India. This program in palliative care training program is a collaborative approach of the Lean Collaborative for Palliative Care in Asia Pacific Hospice and Palliative Care Network based in F.I.A.M.C and Kasturba Medical College and Hospital in Manipal. This program was started with the objective of establishing palliative care subsystems and care services, and I think using morphine in cancer treatment centers in India. She has trained in mindfulness and dignity therapy under Dr. Harvey Max Kochinov. She is passionate about palliative medicine with a keen interest in psycho-spiritual care. She believes that all life deserves respect, dignity, and compassion, and believes in gently shaking the world with compassion. She is a doctor, in her own words, she is a doctor by chance and a writer by choice, and pens her creative thoughts in a blog, www.http://randommusings69.com. I'm sure we'll put it up somewhere on the site for you to access as you want. Of course, then we have our mentor, Father Stephen Fernandez, who was the main motivator and promoter of this Biomedical Ethics Center for many, many years, 16, 20 years. He is the National Secretary of the Catholic Bishops' Conference of India, Office for Justice, Peace and Development. He has been a resident professor of ethics and now is a visiting professor of ethics at the St. Pius College at Goregaon. He is a consultant of the Pontifical Council for Christian Unity at the Vatican City in Rome. And of course, leading and being the honorary, honoring us with a task of moderating the session is Dr. Marianne Mukadum, who's an MBBS MD in radiotherapy and an MSc in palliative medicine from Cardiff. She is a EPEC Master Facilitator of Pediatrics in India, Northwest University. Professor and former head of Department of Palliative Medicine at Tata Memorial Hospital. She is currently a consultant at Cipla Foundation and Shanti Avedana, which is a palliative care center in Bombay. She is a trustee of PalCare, which is in charge of Home Care Foundation. Past chairperson of International Children's Palliative Care Network and past president Indian Association of Palliative Care. Members are of memberships of medical association are many. Prominent among them are ACT, which is an organization for children with life-threatening conditions. ICPN, which is International Children's Palliative Care Network. International Association of Hospice and Palliative Care. UICC Toolkit for Pain, and she's a core committee member of European Association of Palliative Care, International Network for Cancer Treatment and Research, Asia Pacific Hospice Network, and the European Society of Medical Oncology. She is also a member of the Radiation Oncologists Association, Bombay Hematology Group, and Indian Association of Palliative Care, Indian College of Radiation Oncology, Medical and Pediatric Oncology. She has been working in palliative care at Tata Memorial Center for many, many years and has helped in the integration of palliative care into the trajectory of illness as early as possible for patients with life-threatening conditions with their families. Her education of medical student, educational work is with medical students of MD, Palliative Medicine and Radiation Oncology. She gives palliative care lectures in the curriculum of MD Pediatrics, MD Medicine, and MS Surgery for MUHS, and lectures for palliative care in various curricula of nurses. Her research publication, she has more than 50 publications in national and international index journals, many chapters in a book. She has been a principal investigator for 18 major projects and 40 projects where she is the co-investigator, 30 multi-centric international projects, and is interested in ethics and advocacy of ethics. So, gentlemen and ladies, we have this distinguished panel to discuss for the next 90 minutes. They are going to talk to us about grief, bereavement, and handling such issues in our life. So I'm handing over to Dr. Marianne Mukadum to please take over and help us. We will field questions after the speakers after about 90 minutes. So if you have any questions, could you please post them on the chat box and we'll see that they are answered. Yeah. Thank you very much. Over to you, Dr. Mary.
Thank you, Dr. Mittal. Thanks. I'll take over. Too much talking about us now. Let's get to the topic. So, Dr. Mittal, do you have any other words of wisdom from your experience before we get to the other speakers about coping? I'm sure you have a lot of patients, families.
Yeah. For me, basically, one of the felt needs currently is that because of the vastness of this pandemic and the social disruption that it has caused in terms of lockdown, in terms of restriction of movement, you are not able to grieve normally. The normal grieving rituals which are there, like having the 13th day, having your family, your extended family to grieve with you, you have certain rituals that you perform. These are not possible. And people are not even being handed over the bodies of their loved ones. Or if they are being handed over the bodies are being handed over in steel bags in many places. And they are not allowed to say goodbye. I have seen a multitude of patients. I work in Thane, which is been one of the hotspots of COVID. deaths. And I've seen lots of patients who have not been able to say goodbye. The patient has been diagnosed and has been spirited away, or has been admitted to an ICU of a hospital. And that is the last time that the relatives have seen the patient. After that, they've just been given a sealed body, a sealed package containing the body, and told that your relative so-and-so has expired of COVID, and this is the body, if at all they're handed over the body. So all the rituals associated with the unfinished business of saying goodbye, asking for forgiveness, whatever, making amends, have not been possible. A lot of rituals following that, the second day, the third day, the fifth day, the 14th day, 13th day, like in certain culture, there is something called pagri, where there is a handing over of the responsibilities of the families to the next in line, the eldest son or the eldest sibling, has not taken place. Extended families have not been able to come and grieve together. Cultures have not been able to, societies have not been able to gather together to express their sense of loss. So all this is special circumstances in this case. And I'm sure in your discussion, when you discuss the normal grieving and normal grief handling, we will realize how much of this is not possible in this last 8-9 months, and which will not probably be possible in the next few, because we got just hit by the second or the third wave now. And as predicted, we are going to touch 1 crore within probably the next few days. And it is not easy with that many people affected. So that's what I can add, please.
Thank you, Dr. Mittal. So just for the audience, I just want to kind of give you an understanding as to how we are going to conduct this session. There are 3 main things that we are going to be looking at. One is giving a bit of an introduction as to what is grief, what is loss, and how do we talk about mourning. We'll then go on to looking at coping with this situation. And we'll also divide it into chronic grief, acute grief. As Dr. Mittal said, we are going to be, we are in a pandemic, and today, someone, I just lost a very, very close friend. And I just came to know that when my father-in-law passed away, that he is no more. So you have sudden grief, and then you also have grieving in children. So we're going to address these 3 main topics, but we're going to do it in the form of a question and answer, because we thought that if there's more of discussion and it's more active, it will be less boring than listening to some slides. So I hope you will bear with us with this kind of a way that we have chosen to present this topic to you. So can I please ask Dr. Seema, a very eminent person, you've heard the introduction. She's worked so much in the field. She's worked a lot in chronic grief, but then she's also been working now in Manipal. They have a lot of COVID patients. And therefore, she has been very much exposed to handling grieving family members of those who have acutely died as well. So Seema, will you be able to just give us a bit of an overview as to what is loss, what is grief, and what is mourning?
A very good evening to everyone. I hope I'm audible.
Yes, you are.
Yeah. Okay. Thank you, ma'am, for this question. Sometimes when we talk a lot about grief, mourning, bereavement, it is extremely important we understand what these terms mean. We as human beings, as Dr. Mittal said, we are all social animals. We remain connected with a lot of things. We develop an affection and bond with people around us, maybe with our pets, with sometimes home, and there are a lot of things that we value a lot. So whenever something that we value is taken away from us, or something that we have had an affectionate bond with is taken away, that is the time that we experience loss. So loss is, when something valuable gets taken away from us. And this creates a lot of distress. And that is what this distress that we experience, the emotional response to a loss, is what is called as grief. When the grief occurs due to the death of a person, or the loss of a loved one, we call it as bereavement. We have to understand that grief can occur even without bereavement also, because grief can be a loss of a relationship that occurs, as in a divorce or a breakup that happens, or it could be loss of even a job, when you lose a job or when you lose your home. Grief can occur in multiple circumstances. It can occur. And actually, Dr. Mittal mentioned about COVID situation right now, isn't it? All of us are also grieving. We have lost something very precious, that is normalcy. Our normal lives are totally disrupted, and especially during lockdown, I think each and every one of us have gone through some experience of grief, if not of bereavement. When we can't get up and go and meet whom we want to meet, when we can't just move out, dressed as we normally are, you have to wear the mask all the time, right? So there is a collective grief and a collective loss that we are experiencing today. So given that all this, it's very important for us to understand what is happening during this time and how do we cope with it. Just a minute. Okay. So when we come, now we have spoken about what is loss, what is grief, what is bereavement, specifically what is mourning. Mourning is the process in which we adapt to this loss that occurs due to bereavement. And it's a set of complex behaviors that is socially, culturally, religiously, that has been prescribed, that we follow. And we need to follow this period of mourning to adapt to the loss. And today, in the COVID scenario, as Dr. Mittal rightly mentioned, this mourning process is totally disrupted. And that is where patients today or the relatives are more likely to have very complicated grief and, later on. So that is the reason why, though these terms are very much interlinked, they are actually very different. Losing something valuable is loss. Reaction to that loss is grief. Loss of a loved one is bereavement. And the process of adaptation to this loss is termed as mourning. I think the concepts and the word terminologies are clear, I hope.
So I'm just wondering whether we can just focus a little bit on mourning. They say there are 4 tasks to mourning.
Yes. Yeah.
Can you elaborate a little bit on that?
I was coming to it when I spoke about how do you cope with the.
Okay, all right. Okay, so I'll come to it a bit later.
I will just explain that here. Yeah.
Okay, so listening to what you say, you have a loss and then you start grieving and then you learn to cope with it. Do you think that it's something normal, or is it something, we are all, as we said, animals. Yes. So do you think is it normal? A person grieves when you lose someone? Is it something good? Is it something which we should, push under the carpet, or is it something we should encourage people to talk about, which is what we're doing now?
Basically, as I mentioned before also, the normal and natural reaction to the loss is grief. You feel sad, you have thoughts, feelings, behaviors that you will exhibit when you lose something. You feel sad about what you have lost. So that's a normal reaction. And, this grieving is not only present in humans, but in animals also. Studies have shown that, a lot of animals also experience mourning and grief. I think we would have read about a dog that has lost his owner, refusing to eat food and waiting for the person to come back. There has been one instance which in Montreal Zoo, dolphin which had lost its mate had stopped eating and died because of it. So the grieving behavior is exhibited even in animals. So it's a primitive biological reaction. We lose something that we value, we are going to grieve for it. But we as human beings will experience it at very multiple levels. We experience it. Like, it's not only about loss of something, but as I said, it's the loss of a dream. When patients get chronic illnesses, their future is lost. Their dreams for the future is lost. Or when you lose a limb, you end up grieving because your body image gets disturbed and your view about yourself is lost. When you lose a job, also. So it's not only about, loss due to death. Grief can occur at multiple levels. And that is something we need to understand, that it's not only death that makes you grieve, but a lot of losses which are non-bereavement related also can make you grieve.
Is there something called abnormal grief? Have you come across abnormal grief?
See, grief is grief is universal. When you lose something, animals, human beings, everybody grieves. But the experience of grief is very individualistic. So to say it is abnormal, it's very difficult. What we can say is it could be sometimes adaptive, which helps you deal with it, or the grief could be maladaptive, when you're not able to deal with the grief in an efficient manner and interferes with your day-to-day functioning. It can be maladaptive, or what we call as complicated. But to label it as abnormal, then you have to define what is normal grief, which becomes very difficult, given that grief has its own individual variation, cultural variations, socially. It depends on a lot of things, whether the death was sudden, whether that was expected, anticipated. So I would prefer using an adaptive grief, where a person adapts to the situation and accepts the loss and moves ahead, or a non-adaptive grief. I would like to label it that way. But
so one more question then. You have worked in both the sides. You worked in palliative care with us for years, dealing with patients where we anticipate that this patient is going to die. But you have also been working in the COVID field in Manipal in the last few months. So is there any difference you have come across with the family when it was something where we could work with them, where we could anticipate the grief with them, where we could support them, and when it is something which is, within the space of a week or 10 days, the person is gone?
So yes, when it's much more difficult working with acute deterioration or an illness. The acute grief can be extremely difficult to handle. For one, the extent of emotion that a person experiences at that point in time is very intense. So dealing with that becomes extremely difficult. The shock, the disbelief, sometimes there is this emotional flooding. There are too many things happening. There are multiple losses. Sometimes multiple family members are positive, COVID positive. So it's not only the father, the mother is also on a ventilator. We had where 3 members of the family were simultaneously ventilated, and all 3 died, and there was only 1 remaining girl to deal with the 3 deaths. So multiple losses in this particular situation. Obviously, it is very difficult to deal with. One, as we have to understand how the normal grief comes in, how people deal with normal grief or mourning, what happens. First is, and only then can we understand how intense and severe the grief is in sudden deaths. So one, they do not have enough time to prepare when the sudden death occurs. 2, the shock and disbelief is so high, to adjustments become difficult. Acceptance becomes very difficult at that point in time. There is a guilt. I shouldn't have let my mother go out somewhere. I shouldn't have let my family down. I should have gone to the doctor faster. So there are a lot of survivor guilt that they experience when the death is sudden. And sometimes there is also anger, uncontrolled anger at God, at healthcare establishment. If you see, most of the COVID-related violence that occurs is because of the acute grief reaction to the loss that happens. So that sudden anger is, intense angers are there. And also anger at God. They are not able to find the meaning for this loss. So all these contribute and make it even more complicated, the sudden loss more complicated.
Thanks, Seema. Niana, let's come to you now. Sorry, the 2 of us have been talking too much now. So let's bring the expert who has been dealing with sudden death. Your organization is called Safe Space, right?
That's right.
And sorry, I didn't know that you had a personal experience, but can we hear from you how do you deal with maybe, you prevent suicide, I'm sure, pretty much, and maybe the loss of someone who actually succeeded?
Yeah. So first things first, thank you, Dr. Seema, for the very clear explanation and division of grief and loss, and that grieving is a natural process for human beings to make sense and process the loss that they have had, and how important it is to the journey of healing itself and making some sense of what just happened. And it is so important, especially in the space of suicide. So I lost a parent to suicide when I was 13 years old. It was my mother. And while we do believe that suicide is sudden death, actually, suicide, people who die by suicide do let you know. So it was, and I was told every other day that, someday when you come home, I won't be there. Uh, the thing with suicide is, and the reason why it is chronic and also still considered sudden, is that we don't believe that our loved one will leave us. And that is a human being, it's our greatest sense of survival to not lose our loved ones, because by design we live in community, and it's about living in that collective. It's about these people who are supposed to take care of you, and you're supposed to take care of each other. And suddenly somebody, either your child or your partner or your parent, is talking about not being around anymore, and that in itself is a shock. That why would somebody, it doesn't make sense, because you're not able to understand the grief and the uh, bereavement that person is going through, due to which they feel that they need to end their lives, or that level of pain that they're experiencing. All you can see is, why would you do that? Don't you love me? Or why would you leave? Why would you choose to do that? Don't you love me? Am I not enough? Can I not keep you here? Can I not save you? And even till today, when we work with families whose loved ones talk about suicide, and we try to explain to them that, look, it is possible, and so let's get them the help that they need, which is to allow them to grieve whatever they are grieving, because it comes from deep emotional pain. Is that, please take it seriously, because people who are saying it will attempt it at some point of time. It's not attention seeking, it is a cry for help. So that was my experience with my mother, which started 25 years ago, knowing very well that every other day she was kind of preparing me to tell me that someday she's not going to be there when I come home. And I remember living with that fear every single day, that what if this happens. And through COVID, to kind of bring it together, is that the people who were calling us up, to kind of get help, was one of the biggest things was, I can't imagine my life without my loved ones. What if something happened to them? I don't think I can live. And that is a real fear that we were dealing with in COVID. And there is no way that I can tell you that your some loved one may not get COVID, or I can't promise you that could happen. But just the fear was so intense for people that I can't imagine my life without them. That I rather, I'm thinking of taking this step before I have to see that loss. And so loss in itself is so deeply breaking. When you lose somebody suddenly to something like suicide, with that comes this whole question of, again, abandonment, feelings of guilt, feelings of, I could not save. She said it so many times. He said it so many times. Why did I not listen? Why did they not get the help? There are all of those sort of questions. Along with that, with suicide, which is unique, is that sometimes it is very tragic, and also can be very violent. And you live with, unfortunately, and I can speak for myself and everybody else who is in the bereavement support group that we run, is that the only memory or image you have of them, which comes back as extreme flashbacks, is the last time you saw them. And if that was like you mentioned with COVID, sometimes they come back to you wrapped up, because the method they have used has been so that you don't have that closure, that thing of saying goodbye, or that I'm so sorry that I could not do what you needed me to do. So the shock that you experience, the guilt you experience, the fact that you may have heard them talk about it, but you couldn't do anything to save them, because that's what we think we human beings can do. We can save. But the truth is that we can't, and then we recognize that that is our mortality.
allowed to give one more message or only one message?
Please.
Okay, then it's fine. Then I will continue with my messages. Okay, there is another problem which I have found is when we put the volar plate on the volar surface, it is so much easier
one's life, and if that's something that you do, then it's not a different kind of a family or a different kind of a person, and we forget to recognize that suicide comes from a tremendous amount of emotional pain. So there's several things that actually I wanted to kind of talk about here. One is in the process of mourning itself for suicide. One is first acknowledging that it is, and like I said earlier, that many times families don't, and they call it an accident, or they say something else happened. So then you're not really grieving what has been or what has just happened. So when I was young, I was told, oh, but your mom, didn't died of asthma. And here I was at 13 who knew what had happened to her mother. And I was being told by family to lie about it. That means something was not okay. So we as families, how are we talking about it to our young ones, to each other, gives a very strong message. So here I was, this 13-year-old girl who was willing to acknowledge that her mother took her life because something was not right in her family. There was something wrong that back in the day, it was mental health, which was not recognized. But I knew there was something. My mom was struggling with something. But then I learned very quickly that is not allowed to be said. It's not allowed to cry about it. It's not okay to talk about your mother anymore. Suddenly she's persona non grata. So not only did I lose my mother, but I lost everything about her. Talking about her, memories about her, crying about her. Today at 40, when I look back, I'm like, I can't even remember. But I remember the last few moments when, I found her, and those are the only memories I have of her, which is very, very difficult till date, because when you have something as strong as a death by suicide, you get left back with something called post-traumatic stress disorder, right? And you're left with that, the anxiety, the flashbacks, the all of those things that you have to live with no matter when you experience that. However, like Dr. Seema said, if you're able to talk about it, if you're able to grieve it, if you're really able to feel the extent of the pain that you felt with the abandonment, with the feeling with suicide is, did I do something bad? Especially with children, we get left back feeling that maybe we weren't the loved ones, we were unwanted, we did something bad, and nobody acknowledges that. And then you grow up with that feeling of, I'm a bad person. Somehow there's something wrong with me. And there's a whole second level of mental health that comes with that. Anxiety disorders, depression, all of these factors come for factors when we don't truly grieve the loss of our loved ones, especially when it's traumatic, especially when as children we get the indirect message that it is zip. No tears, please. There's no room for any of that here. And it's such a disservice we are doing to each other, even as family members, as society, when we start isolating. And then there's a second level of the police investigations that start with it, right? So before it wasn't decriminalized, today it is, and yet we don't know the laws that go with it. And at that point of time, I was trying to tell my father had nothing to do with it. This one had nothing to do with it. As children, you're defending. So where is the process of mourning and all of that, right? There isn't any room for that. You're barely trying to stay afloat. You're barely trying to make sense of the loss that just happened. And then there is all of this other stuff that comes with, the police, and then you get into the rituals, of course, like you discussed, and the rituals teach you something. But when there is suicide, there is a whole another level of thing that comes, at least in Hinduism, I can say, is, oh, suicide is bad. This person's not going to go to heaven. Your family is doomed now. Oh, you need to do these 150 different havans. And if you don't do that, the person will never gain peace. And you're left with so much of fear. So much of anxiety for the one who's gone. Where are they going to go? Are they not going to go to heaven? Is my mama not going there? And you hear all of these things, and they become, really, really difficult things to either take on, because, if you do believe in the afterlife and where you go from there, and that is important to you, this becomes hard. And for me, unfortunately, and I've seen that in a lot of suicides, and most of the people in the room in our support group, is they give up on God. And that's one of the most fundamental things that I've seen happen, because if God was there, he would not put me through this. Or if my mother loved me, or my loved one loved me, or my son, or whatever, then, and most of your life goes carrying that burden of that guilt, that I didn't do enough. That what if this hadn't happened? What if I hadn't slept that night? What if I had, listened more? What if I had done this? Or what was the last conversation the person had? And your whole life goes into like almost a 007 to unsolve, or, to solve this mystery of, why did my loved one leave me in this way? What didn't we do? And then comes the whole blame angle, and we want to blame each other. You didn't do enough, and you didn't do enough. And when she told you this, but ultimately you come away blaming only yourself. And when you blame yourself, you're left with that feeling of, I don't deserve to live then. That survivor's guilt. So we know that 60% of those of us who lose a loved one to suicide are at risk of suicide ourselves. Because you can't live with that burden. It's too hard. And when you're not able to talk about it, and you're asked to keep quiet, and there is not that room for Dr. Seema that you beautifully laid out, which is to really access your pain and feel it, you are also not able to make a meaningful connection with the person who's gone, because there's so much of those questions, and there's so much of I can't ask anybody else. What happened to mom? Till date, 25 years later, in our family, we don't talk about it. My brother and I, and that's another thing we see in families, is that the closest people fall apart. You don't have a family left. My brother and I took years to start talking to each other again. And, I don't talk to my brother about my mother. So there's nobody really left to talk about and know what happened, or, all of those sort of things. So to talk about that meaningful connection, which, like you said, is possibly the path when, or the place where you reach when you're integrated. I think with suicide, because we don't have all of those processes, given isolation, given stigma, given the lack of expression, given that, we get this message that it is not okay to talk about it, lie about the death, all of those sort of different things, you're left fragmented. And that integration doesn't really happen fully. Like, you're always left with a big gaping hole that you're trying to fulfill for a very, very long time of your life, and I think that, when we talk about what can we do, can I talk about that, Mary, right now?
Yeah. Short, because I think we're almost 1 hour over. We have only half an hour left.
Yeah. So it would, what we when we were talking, I started, kind of had a friend who lost her father recently 3 years ago. She was my best friend. I had never once told her that my mom died of suicide. When her father died of suicide, I told her for the first time, having been her friend for I don't know how many years. And that's when we started this support group, because we realized that talking to each other about it felt so, it just felt like this burden was lifted. People could understand that, don't oh, it's so many years ago, get over it, and it was not your fault. And you don't understand that. We don't understand that, right? Especially when you are it's a parent or a child or whoever it is. And so we started this support group, and we found that there are so many out there like us, some who hadn't spoken about it for 40 years, who started talking about it for the first time. And we started this about 3 years ago, and I can safely say that many of us have started to find that integration. Many of us are today able to make sense and develop some form of a meaningful connection. And that is possible. But it's possible when you're grieving alongside people who have experienced the same grief as you, and not telling you to move on or give you the space to really say, hey, you know what, 25 years later, like you said, the pain may not be as intense, but those memories are there. The pain is in some ways still there. There's a huge scar. And yet there is some semblance of, healing of that guilt, that there was nothing more I could have done at that point of time. And that's what I would say from the perspective of suicide, of course.
Thanks, Niana. So can I just add a little bit about children, and then we'll ask Father to give us their experiences. So Seema and Niana did talk about expression. And I think in children, the basic problem that we face is how are we going to help them to express? They don't really talk the way adults, you give an adult a space which is private, and, when they don't feel hassle, they're going to speak. But children are not always able to do that. And it's sometimes the most unusual person who can reach out to them. It's not always the counselor. It may be their friend. It may be one of your aunties. It may be one of our, we found many of our volunteers, because of such a kind way that they speak to the children. They sit down with them. So, when you want them to get them to express, sit down with them in a private room, maybe most probably away from their parents. Give them something to help them to express. So it's not just talking. It may be drawing. It may be writing a story. It may be a diary. It may be a story of someone else, which you pick up and you start reading to them, and they kind of learn to identify with them. So it's helping them in many, many different ways to express themselves. And that's why I feel that the person who's working with children who are grieving needs to be experienced, because one small little thing, can immediately stop the flow of that conversation. And the other thing which we have realized with our experience is that it's much easier for them to speak when the parents are not around. They may speak to their friends more than they speak to, to their parents, and especially for adolescents. So I think grief counseling for children really needs to be experienced. You need to take them safely over those, stages of mourning. And just like William Warden has written so much for adults, there is somebody called Sandra Fox, and I think that they work together, if I'm not mistaken, who has talked about similar stages of mourning for children. And you've got to lead them by the hand and take them across. How we, as when someone dies in our country, whether it's Christian or Hindu or Muslim, hide that what happened from the child.
Yeah.
But actually, that's not the right way to go. I'm not saying that we have to take the child to the funeral, but if we do take the child to the funeral, which is good for them, but it has to be done in a very empathetic way. So usually if there is someone else who can accompany them, who can explain to them what exactly is going on, and help them to understand, that whatever that ritual is, whether it's, the service which we have as Christians, or whether it's the prayer which is there, which is before the actual cremation, these are things which actually help the child to adjust to the fact that their loved one is permanently gone away. And even if they actually see the ritual, the burial or the cremation, in a very humane way, so that, it's not something which is frightening to them, but it's something which helps them to understand that this person has now left me, and there is someone who's accompanying them. There was someone who's listening to their questions. There's someone who's willing to give them an honest answer, which may even be later, not only during the ritual, but even later, would help them to grasp the situation. And as I told you about the cyclical behavior, that, they can grasp it. I mean, they can identify with it and then they kind of regress. So keeping an eye on them would help us to know when is that opportunity, when they're ready to talk about things, and then possibly to reach out to them. So it's important that, you help the family also. It's equally important to help the parents of a child who's grieving. Like, for instance, if the father has gone and it's the mother, or the mother has gone and it's the father, it's important for the professionals to help the father and the child, or the mother and the child, to identify with the grieving together. And that's again where I do believe that, we have a lot of volunteers who work with us, but we have to train them. And we really train them in a way that they are able to, help in this process of the child and the parent, the left behind parent, to be able to grieve together. And I think I just want to, besides Sandra Fox, I think I just want to draw your attention to a lovely paper which is written by somebody called F.I.A.M.C. She's written it in the Indian Journal of Mental Health 2020. I haven't read the paper myself. I'm not sure whether it has, maybe she wrote it in the relation to COVID, but it's a beautiful paper which really gives you an understanding of how to deal with children who are grieving. And just like Niana said, when it's a sudden death, then the risk of depression and post-traumatic stress disorder is very high. And therefore, probably those children who have lost their parents, even now to COVID, they would really be, needed to be taken care of even up to 3 years.
Yeah.
So we can't just, okay, we've done our job now, whatever it is, 40 days or 3 months and 6 months, and think that, okay, now they're fine and they're going to carry on. So this PTSD can come even up to 3 years. And if it is, even though it's not common, it's less than 10%, even in children. But that watch needs to be kept on these children to see that, they are going through the normal process, which Seema has described to us so nicely, and they're able to come out on the other side. And this paper is also a paper in JAMA 2011. And I would, if anybody has the time to look at these papers, I think you'll find them very interesting.
Dr. Mary, can I say something?
Yeah,
here?
Please.
Just to, especially with suicide loss in children, or even children in general, is to let them know that they're truly loved and nothing they did, and that in no way they are responsible, and that, it is because you experience a loss different from your friends, and your friends' parents are there, but somehow your parent was taken, and to just remind them. So that's the first one, that it isn't their fault and they're truly loved no matter what, and so did the parent who went away. Love them really, really a lot. And I think one of the things that we always tell children is, now you have to be strong for mommy, or you have to be strong for papa. It's not a child's job to be strong for the adult. Let the child go through their own grieving. And I think when you rightly said, Dr. Mary, about allowing the mother and child, but finding ways for them to grieve together the loss of the person, rather than saying to the mother, don't grieve because of your child, and telling the child, don't grieve because of the mother. And then it's, so many people who come into today, several of our, conversations are children who have experienced PTSD but said they were never able to grieve. So, let's let grieving is the most natural form of healing when there is loss. So, it's actually a good thing to grieve. So, giving each other the space to able to do that, especially children, because if we don't, then PTSD and other things do come up. So that's just something I wanted to share, is that let's not give the burden to the child to not, grieve because she's responsible for an adult, so.
Yeah. So again, let's get back to Father Stephen. Father, ethical issues and personal experience.
Yeah, so thank you so much, and very engaging conversation so far on these issues. And I'm really so happy to connect with Dr. Seema and Niana, and also you, Dr. Marianne, for this really way our program this evening is getting developed. See, what point I would like to make, of course, besides giving the personal experience, is that, today there's a shortage of what we call spiritual and bereaved caregivers. There's a lack of it in society, and we need to do something in this regard, because we are talking of the issues of number of bereaved people going on. It's growing. As Dr. Anikal mentioned, now we're going to go to 1 crore people who are died there. So, I mean, see the tremendous amount of pastoral scope, and we need to reach out to people in so many ways. So in this whole aspect of training people, the whole point we have to make from my personal experience now, because, I'm giving you the juice of my personal experience for the last 20, 30 years, involved in with lives of people there, that the person should feel the other is present to him, should demonstrate love, should show compassion, and refrain from making any judgment. As Jnana has mentioned that very carefully, not to show that you are really you are guilty for anything. That person has died for whatever happened, etc. So now we have many focus on the religious meaning, connections with the deceased through prayers, visiting the graves, putting candles, flowers, wreaths, bouquets, offering mass, giving kind of memorial cards with pictures of people. Now you'd be surprised abroad, they after death, they sometimes, for some people, they even visit the graves regularly, regularly visiting the graves, and and they have that connection, that bonding with the deceased. I know people who have even visited graves every day sometimes. I do not know how you would react to that, but this is some way in which they want to re-establish. But as both our other speakers have said, we need to also make other connections, other activities, so that they let out the steam, which is a starting way in which we can lead to the healing process. Because one important factor is that loneliness triggers. There's an empty house, being alone in the evening and weekend especially. Sometimes there's anger taking place. Sometimes there's guilt and blame, blaming others, blaming oneself. And that leads to lack of self-forgiveness. And that also can be something very important aspect, to how to heal oneself. Loss of hope for the future is another point. The future seems bleak. The bereaved person at this time, seeing a bleak future, may experience intense anxiety. The next task I would say would be, as Dr. Seema mentioned, to accompany the person through the pain of bereavement. It's hard work, bereavement. It's painful. Suppressing feelings can delay the grieving process. Pain must be acknowledged and to be released. So we don't distract the mourner from this important task, in our providing comfort. And the next task would be to adjust to the environment. I've seen there in my lot of experiences that when you help the person to adjust to the environment without the deceased, sometimes the new role can be frightening, it can be burdensome. The reality of living without the deceased starts sinking in the person. The feeling of helplessness arises. And then you gradually move to how to help the person beginning a new life. Emotionally relocating the deceased and investing in new kinds of relationships, a new identity and search for meaning. Viktor Frankl, in his book, Man's Search for Meaning, he explains there how, when he was in prison, how he saw other people dying there, how his will to live had kept him from living, and finally he was luckily released there. So we have to help people find meaning in their lives to continue living. This can be difficult for some people. And again, I repeat, the feeling of guilt and allegiance to the deceased may surface again. But then remember, we have a lot of tasks to do, how we can proceed in this manner. The next would be how we can reconstruct the belief systems challenged by the loss. So here comes the aspect of counseling. Here comes the aspect of when the person's faith may have been shaken, as Dr. Nyanya spoke about belief of life after death. Spoke about how that can be challenged. So again, how we can reconstruct the person's life. I would like to say that in my experience there with regard to spiritual encounters with people, listening to people without judgment, that is a great help. People just want you to just listen to them, to pour out their hearts in a non-judgmental way. This helps them to boost their self-image. And one more therapy I would recommend, which no one has spoken so far, is music therapy for the bereaved. That would be something very much to explore. Today, a lot of studies have been done on dance and music therapy, but music therapy is something that would help the person slowly integrate in his or her system, all these aspects in his life. Finally, I would like to say the grieved person needs a lot of support, spiritual support, guidance, to keep on staying in touch with relationships. Try to remind the bereaved that you're thinking about them and that thinking about the loved one who died, and this constant interaction, communication helps the person in their relationships with one another. And this will be a great a contribution, especially to those who are engaging in spiritual connections and ethical response to the bereaved people. So that's my short answer, Dr. Marian, in view of our time factor.
Thanks, Father. I just, before, I know it's almost time for us to end. So I just want to ask for 2 comments from our Seema and Niana. Seema, you have done a lot of work on dignity therapy. I want to hear from you, how that would fit into our coping with bereavement. And Niana, I want you to then tell us about the role of support groups and, this. We've talked a lot about individual helping, but I think we also need to talk about collective.
Thank you, ma'am, for that question. Before I start about dignity therapy, I would like to talk about Father Stefano mentioned about Viktor Frankl's man's search for meaning, right? So there is a therapy that we use in palliative care for people who experience the spiritual and existential distress called meaning-centered psychotherapy, which is developed from from the book, So where we help people find meaning, especially when they are facing death, how they find meaning and purpose in life. So coming to dignity therapy, this is for patients for anticipatory grief. When patients and families go through anticipatory grief, impending death is imminent. They are seeing, patient is likely to die in the coming days. Both the patient as well as the patients go through anticipatory grief at that point in time and start to question what is the meaning and purpose in life. So this dignity therapy is a sort of a life review and building legacy, which is integrated. Like, you ask the patient to look back into their lives, find the most important events that has occurred and how it has shaped their perception of life, how they found meaning and purpose, and what is the legacy that they want to pass on to the next generation. What is the words of wisdom they would like to say? Done over a period of this interview is fully recorded and then it is transcribed and a document is made which is handed over to the patient, and the patient hands it over to the relative. This is how the dignity therapy is basically done. So it sort of gives a memoir or a words of wisdom from the elder who is going to die to the family members, and it helps a lot in grief at that point and going through the bereavement. That connection, what we say, it helps in the mourning process. When they open it, they relive that experience. They sort of connect to the loved one who has gone away, and for the person who's dying also, it gives a greater clarity and resolution of their grief. So this is one therapy that helps provide meaning and a spiritual connection at that point in time. So we use it a lot for existential and spiritual distress during end of life.
Yana?
Yeah, so we have some support groups for families who are left behind, and we call that We Hear You, because we genuinely do. It's run by all of us who are, it's like a peer support group. So nobody outside of survivors actually participate in that group, and it's led by each other. We kind of meet every first Tuesday of the month, and we share right from things that didn't things that we remember, dreams that we have of the people gone away, the stories of guilt, the stories of our own fears that we live with, fears when parents talk about, hey, I lost my parent and I every day fear for my child, what if they, and we have these real discussions where we are able to really express. First things first, acknowledge that we lost a loved one to suicide and we don't have to hide it. And secondly, when I say that, look, I'm still carry that, somebody else who's been, has lost somebody for 40 years ago says, hey, I do too. And we, acknowledge that. We don't give opinions. We don't have judgment. We don't give advice. We just share. Sometimes people come in and they don't talk at all and they just, stay there in silence. And we acknowledge that silence. Some of us have been there for, people have lost someone many years ago. Some of them are new, and we kind of support each other because we give hope to each other that it is possible to go on, and it's possible to reach out and say, I'm having a bad day. Today is the day they were born. Today is the day they went. Diwali doesn't feel the same. All of those sort of different sort of emotions that are only known to those who have experienced that loss. When I went to learn how to run a support group, I always asked, when would I know that somebody is healing? And the person told me that when they are able to do something meaningful with their loss, similar to what Dr. Seema shared is fine, and Father Stefan said, is that finding meaning in that loss. And so many of our support group bereavers who came in, absolutely fragmented, broken and shattered. Today, somebody's written a book, somebody's writing poetry, somebody's writing a blog. And that's when you're able to see they're okay. And they're like, we want our loss to help someone else, and that's how even our support group started. And today, safe space, that, when I was sitting in that room, I said, why are we even here? Suicide is the most preventable death. Why are we still here? Why are 50, 60 people on the support group? Why do we lose 285,000 people a year to suicide? We shouldn't be, we shouldn't be in this room. And therefore, to start doing something with what we learned from this loss, so that we leave this world a better place, so that we are able to maybe help one other person through that grief. And I think that's really the journey of, reaching that space of, okay, there's nothing I could do, but what, I can go on and I can find meaning and I can, live out not that legacy of, somebody who lost someone to suicide, but somebody who also able to do something to help someone else.
Thank you. I think, Dr. Mittal, we need to hand over back to you, if I'm not mistaken, because we've
I did, Dr. Seema was supposed to come and give her last comments about self-help groups. Did I miss that?
No, I did. Seema, you want to say anything more?
No. I think we've spoken. There was one question that I saw. It's about not suppressing your grief and not experience that grief. So just to answer that question, this is very common. We tell you have to be strong. You have to face it. And I still remember when my paternal aunt passed away. I didn't cry. I had just passed out of my MBBS at that point in time. I came home. I sat next to her. She brought me up actually, and I was just holding her arm, and she died. And I didn't cry during that time. I could never cry. It was in about 4 to 5 years later, I wrote a poem saying goodbye to her. After I finished writing that poem is the time that I broke down and cried for that loss. That is when I realized my coping style has been more of instrumental without, expressing my grief. And that is when recently my mother had a accident, and the grief, same thing happened. I was busy doing things rather than grieving the fear, letting myself feel the fear. I became the doctor daughter, not the daughter, So, and it took me, but this time I was a little more smarter. At the end of everything, I said, I need to feel the pain. I sat and I cried, to let my emotions out. So, never mind, it doesn't matter when, but you need to grieve. Sometimes situations are such that you cannot grieve at that point in time. Especially, I have seen when there has been multiple losses now in COVID, families are not able to grieve. They have to finish one, and then the other person is sick. So they are jumping between all this, and plus there is no mourning happening. So that grief is sort of, there. So during the bereavement call, when we make after 2 weeks, when I make the bereavement call, I make more frequent bereavement calls, and I give them that expression to give them that opportunity to cry, and I do it through teleconsult, not even telephone, so that face-to-face interaction is there, and allowing them that safe space to cry and say it's okay. The minute you say it's okay to cry, the dam sort of bursts, so it doesn't matter if
so if I can interrupt here, can I, Dr. Mary?
Yes, of course.
The question that was actually going to follow immediately, luckily, it has been Dr. Seema has led to the question. One of our listeners, Sonia Rodriguez, and she is seconded by Shimisina Verghese, that experience that people applaud you when you do not show grief, saying it is good you are back to normal. Over a period of time, not grieving during loved one's death makes one feel insane and numb. How do you make up for not having grieved during the death of a loved one? And Dr. Shimsina says that yes, people praise the person who do not grieve because they do not understand that you need to grieve. And just, I think part of it was answered by Dr. Seema, but I'd like to ask anyone from the panel.
Niana wants to say something.
Niana especially, yes, please.
Yeah. So, in India, we applaud something called strength versus crying being weakness.
Resilience.
And resilience, and using words like that. And we all want to come across looking strong. We have gender disparity. Men don't cry, women cry. And all of those things are actually things that we want to live up to, but is not true to human nature. And we have something called grieving and tears and crying. They're given to us to heal with life's challenges. And there is dignity in crying. There is a acceptance of self in crying. There's an acceptance of the loss in crying and grieving, no matter when it happens. Sometimes it happens immediately. Sometimes it happens 1 year later, 2 years later. But denying yourself the grief and the process of it is actually detrimental to mental health and physical health, because the more you keep it bottled, that later on, like you rightly said, you become numb. And then feeling becomes really hard and really, you hold it within you. And all said and done, that has to come out someday. And it will come out maybe in a bigger way, but allow it. We're almost afraid of feeling pain. But pain is a part of life. And if you don't feel pain, you don't feel joy. That is, they come from the same places. And when people are applauding you, it's probably because they themselves are afraid of you feeling uncomfortable and may not know how to help in that situation. So if I'm almost applauding you for it. But, I think that what we need to applaud is when we're able to be human and real and authentic about how we feel, because that's when we genuinely are. So I hope that the next time after this thing that we all go back out and, put a hand on somebody's shoulder and say, please make time to grieve. Truly, please do that. And I'm here with you in silence or whichever way, but please grieve.
Right.
It is required for healing. If we don't do that, healing does not occur.
So can I just add one sentence to that, Dr. Mittal? And I think
please go ahead.
We feel uncomfortable. When the person wants to cry, we start feeling uncomfortable, and we kind of transmit that feeling of discomfort to the person, and then they kind of dry up. So I think it's very
that is where the tradition of hiring professional criers or mourners.
Yeah, okay.
There are ladies who you hire who come and who very vocally and verbally do loud crying and chest beating and all that during funerals to help other people to expiate their, angst and their unfinished business. One other form somebody has asked about: how do you help children begin grieving? I'm not very learned as all of you are, but in my course of work in the last 35 years, I've seen that asking children to prepare pictures of collage into a collage with the loved one, especially if it's a parent or a sibling or a pet, putting pictures together, making an album, writing a letter to a loved one who's passed away, kind of helps in sorting out a lot of unfinished business in terms of their expressing their grief and their sense of loss. One of the major issues is that everybody says, "Waqt ke saath bhool jaoge." You will forget. Don't worry. What we need, what I begin my sessions with is, remember, you will never forget. The person you have lost has been a significant person in your life, whether it's your pet, whether it's your parent, grandparent, your child, your friend, whoever, has been to date some significant person in your life, which is why you're feeling this sense of loss. So how you can make that memory dissociated from the emotion is what you need to learn. And we have to help them grow through the emotions, as Dr. Seema mentioned, Dr. Naina mentioned, you mentioned, ma'am, that helping them grieve in such a way that they are able to dissociate the thought of the person from the emotional upheavals that they feel. So slowly over time, they can think of the person and think of the fond memories, the good times they've had, and not feel so distressed about losing them or them not being there. And accepting the reality of them being there becomes very important. I think there was another question which I believe, there was Dr. Seema Unikolia Rao, who said that providing the safe space for grief with unconditional regard, genuine concern and compassionate care. Is this something very similar? Isn't this very similar to what Niana, you mentioned that your NGO provides? Is something?
Sorry, can you repeat that, doctor? I think I lost your voice.
Yeah, providing the safe space for grief with unconditional regard, genuine concern, and compassionate care helps grief. Yeah.
Yes, that's essentially what our support group does. It tends to hold that space, a safe space for us to grieve about, just grieve. I mean, just creating that space to able to do that once a month. I think somebody else had mentioned to me that there was usually a tradition that people should grieve once a month. And that was actually a tradition that I think Dr. Seema, you mentioned that.
Dr. Seema, just elaborate.
Just elaborate on that, because that really stood strong with me.
Yeah. What happens is in our tradition, in our culture, that in the Hindu way of thing, you have a 13-day of mourning, and the 13th day is the Vaikunta Samarodhana that you say that you finished that. After that, on the particular tithi, what we say every month where the a person has died on that particular day, we sort of give offerings for that person till the end of 1 year. At the end of 1 year, we have this Varshantika, what we say, the death anniversary at the end of 1 year, which is a little bit of a puja. And after that, that monthly grieving is stopped. So the ritual of grieving goes on till a year in the Hindu culture,
Slight correction there, Dr. Seema.
Yeah.
It is not only in Hindus, it's also in the Catholics. Yes. They have a month's mind mass, and they have a remembrance mass. They have the anniversary. Other cultures, Muslims also have that.
Yeah.
But part of it is that we experience certain cultures, like the original Hindu culture actually experiences or follows the strict ritual of every other religion, that they have All Souls Day, we have Shraddha, month of Shraddha. We do have something called Pitru Shraddha, where you actually worship all your ancestors and parents. Every year there is Shraddh ka mahina hota hai. That month is a month where you do not buy new objects, you do not buy new property, you do not acquire new things. You actually do not celebrate that month. That month is a month of paying obeisance to your ancestors who have gone and who have left you as their legacy, because you carry on their legacy and their vansh. And there is a specific day called Pitru Shraddha, where you actually perform a ritual to, now it is, Pitru is not only the father but of your ancestors, and you actually perform a ceremony where you pray for the soul of your departed near and dear ones, especially the elders. So yes, what you said is right. The cultures do have a continuous process of rituals and customs which help you remember and formalize your grief process and grieving. And that is exactly one of the main ways in which we can do. What has changed now in the last 9 months is the narrative has changed, because the access to these rituals, even if they are permitted by law or by societies, is not available. And I guess that once the pandemic is over, we are going to feel the need for a lot of resurgence of these ceremonies and these customs to help a lot of people who have suffered losses, not only of loved ones, but as Dr. Seema said right in the beginning, I concur with her, loss of jobs, lot of businesses, lot of lifestyles, loss of whatever they had achieved, a loss of opportunities, and people are going to need time to, rant and rave and, get rid of all those negativities that they are carrying with them now. So excellent. I think we've had a very good discussion. I would, I can only express my thanks on behalf of the Biomedical Ethics Center, but to formally thank all of you for taking time out on a valuable Sunday evening to come and spend it with us to enlighten us. I call upon Dr. Rohan Mascarenhas, our trust secretary, to come and give you a vote of thanks formally from the trust, please. Dr. Rohan, please.
Thank you, Dr. Anupant. Yeah. First, I'd like to thank the doctor by chance and writer by choice, Dr. Seema Rao, who helped explain very clearly the acute to integrated grief in the example of a finger cut to scar. I think that was the best explanation we could get, and how the infected wound meant completed grief, which requires help. She also spoke about bereavement counseling, where we walk alongside with silent listening of the heart, and she told us about anticipatory grief and dignity therapy. I'd like to thank the suicide interventionist, Ms. Naina Sabarwal, who, having lost her mother to suicide, told us about the isolation she experienced, both spiritual and social, because of the stigma and shame associated with suicide, and how she channeled her grief constructively by co-founding support groups, the We Hear You and Safe Space. I'd like to thank my very dear friend, Father Stephen Fernandez, with whom I have worked for over a decade, and who has set up very strong foundations for our organization with his hard and relentless work. He explained about the 5 stages of grief, from denial to acceptance, how people challenge God with what has happened, and how pastoral support, love and compassion help them re-find the meaning in life. The 4th, I'd like to thank, who in my mind is the little Mother Teresa of Mumbai, Dr. Marianne Mukherjee, from whom my eldest son, who is at KM Hospital, has derived inspiration to promote palliative care in neonatology. I myself, as a pediatrician, have learned a lot about grieving in children from the way she explained the various manifestations, clinical manifestations, age group wise in the less than 2 to 5 adolescents, etc. And how we help them with experiential therapy of storytelling and diary recordings. Not forgetting Dr. Ashok Shyam of OrthoTV, with whose help we were able to live stream this entire program on YouTube. Father Joachim Fernandez of the Salesians of Don Bosco, who prepared the flyer for us. My own colleague and managing trustee, Dr. Nicholas Antau, who shoulders tremendous responsibilities of our organization. Our academic team, Dr. Anukant Mittal, who has given our organization a new face. The board of trustees, our alumni, and the participants of the current certificate course. With all of you all, this would not have reached the level it has been taken to. Thank you very much, and thank you for attending and your kind attention. Thank you and good night.
Nice.
Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thanks to Ms. Sharon, who has been helpful in organizing everything and keeping everything in space and place, getting us back online after 2 breakdowns. Thank you very much, Sharon. And mostly, last but not the least, to thank Dr. Nicholas Antau, the managing trustee, for encouraging us to organize such programs more and more, and keeping the Biomedical Ethics Center active and alive during these trying times. Thank you all.
Thank you, Dr. Amita.
Thank you, everybody. Thank you.
Thank you.
Thank you. Bye.
Program.